Hello, I'm Dr. Amit Palkar. Today we are going to talk about diabetic retinopathy. Did you know 1 in every 10 individuals in India is affected with diabetes mellitus and many more undiagnosed? In fact, India is the capital of diabetes mellitus. So, let's today understand how diabetes really affects our eyes. Before we understand the effects of diabetes mellitus on our eyes, we need to understand how our eye really works. This is how our eye is. There are majorly four structures in our eye which are responsible for vision. The most important structure is the nerve of the eye, which is connected to the brain. The second important structure is a structure called retina. The third important structure is the lens of the eye. And the fourth important structure is the black part of the eye what we see from outside, which is called as the cornea. How do we see? Is that light enters like this, and because of the cornea and the lens, this light gets focused on one particular part of the retina. Once it is focused on the retina, a signal is generated, and then this signal is transmitted to the brain via the nerve. In general, we all see like this with both our eyes. When a person has uncontrolled blood sugar levels or the blood sugar levels are fluctuating, instead of a stable blood sugar levels, the initial changes that occur in the eye are some bleeding spots in the retina. These are small hemorrhages which occur in the retina. This is the first stage of the disease, which is in fact reversible if the blood sugar levels of a patient is under control. When the disease progresses to the second stage because of persistent uncontrolled blood sugar levels, some swelling starts occurring in the center part of the retina where the light is focused. This is called diabetic macular edema. In essence, what happens in the retina is reduced blood supply. Now, when there is reduced blood supply, the retina tries to make its own new blood vessels inside the retina. This is called neovascularization. This is the second stage of the disease and needs treatment. If the patient persistently has uncontrolled blood sugar levels or fluctuating blood sugar levels, the disease progresses further to the third stage, wherein these blood vessels, which are very fragile, they break and cause bleeding inside the eye. This is called vitreous hemorrhage. When this bleeding persists for a longer duration of time, they start causing pull to the retina, which is called retinal detachment. The third stage is a very critical stage of the disease and requires urgent treatment. In order to diagnose diabetic retinopathy, we need to do a complete eye examination, which also includes fundus examination. In order to do a fundus examination, we need to do a dilated eye examination. When we dilate the eyes, the pupil of the eyes increases in size. When the pupil of the eye increases in size or dilates, we are able to see your retina. When we examine the retina, we typically see the complete retina and the optic nerve of your eye. This is how your retina looks. This is the center part of the eye where the light gets focused. This is the optic nerve where the signal is transferred from the retina to the brain. This is the macula where the light gets focused. Typically, initially, in these diabetic changes, you see these red spots developing. This is the early stage of the disease. A later stage of the disease is when the patient starts developing new blood vessels in the retina. This is neovascularization. When we have neovascularization or diabetic macular edema, typically the patient needs treatment in the form of laser therapy or injections in the eye. When the disease progresses to the third stage, where there is bleeding in the eye or retinal detachment, the patient usually needs surgery. If you have diabetes mellitus, then you need an eye checkup every 6 months. In that way, your doctor can diagnose these changes of diabetic retinopathy and help prevent this irreversible blindness. Thank you so much.